So watch this if you're gonna get a root canal done. This is a great animation that it was done. It's gonna show how root canals actually work and what we're trying to do in the dental office. This 3D model is way better than a live version, because a live version you can't see down into the teeth like you can here. And with this example, all that black stuff is decayed tissue, decayed tooth structure, bacteria, biofilm, however you want to call it. And so right now they're taking away all the decayed tooth structure. They're going through the enamel, the dentin, into the pulp chamber, and they're going to go into the root canal area. That is where all the nerve and the blood vessels are from the teeth. Now they're going to shape those canals. So you can see that they're gradually removing all that decayed tissue, all that black stuff, with these different rotary instruments. And you need to be very careful to make sure you remove everything like they're doing in this example, because if you do not remove everything, you can get reinfection. So now they're putting a little sealer, and then this stuff is called gutta percha. That is the stuff that's going to stay in there. It's an inert substance that actually stays in those teeth to make sure it remains strong. If you don't have anything in there, the teeth are just going to break. In this particular example, they're really taking away a lot of the tooth structure again to put these little posts in there. At our offices, we rarely do this, very, very rarely do this. Some other countries, they do this pretty often, but this example, there's some posts in there to strengthen the teeth. And now they're going to cure that tooth and cure the composite around it so it's nice and strong. But if you can keep the tooth like that without putting a crown on it, it is just going to fracture. It's going to break, so all that root canal is for nothing. So if you're getting a root canal done on the back tooth like this, make sure you get a crown, and they're going to show this. And once again, they're taking off a lot of tooth structure. Most offices don't take off this much, and the crown is placed, and that is in general how it goes. So if you're getting a root canal, let me kind of go over this again. Essentially, you're going to do the root canal in 1 or 2 visits. Then you either that visit, you're going to get the impression for the crown and then come back another time. So typically it's going to be 2 to 3 visits-ish, depending on the severity of the infection. But that's why root canals are so important, so you can get rid of that infection before it spreads. And some people will ask me, well, can I just take antibiotics? Isn't that just gonna make it go away? And it will not, because the underlying infection is still there. It would make our lives so much easier if you could just take a pill or something that we could give you and the infection would go away and life would be great and that'd be awesome. But unfortunately, that does not exist. If it did, every dentist would have it, but right now it does not exist. And if you don't fix that infection, you can just leave that in your mouth because you don't like root canals or you don't want to go to the dentist, which I understand, that infection will continue to grow and spread, and obviously we know that's not a good thing. So that's why I'm trying to educate patients as best as I possibly can to let them know about root canals, or about if you have a big infection, what will happen. So once again, Dr. Nate here at Thrive Dental Orthodontics, and as you know, I'm putting out videos every single week. I'm trying my best to answer as many comments as I possibly can, so please like and subscribe, and I'll see you guys in the next video.